Yes, hello. My presentation today is going to be on changes in hearing threshold and auditory brainstem pathway and how they correlate with trigeminal nociception in a preclinical chronic TMD model. So the major goal of this study was to use the established model that we have that's based on clinical data in which prolonged jaw opening can actually cause trigeminal pain. And what we wanted to do in this model was to begin to look for hearing changes that are associated with this, because studies from, like, for example, the OPERA studies have indicated that there could be hearing changes associated with TMD pathology. And to be able to do this, we basically injected CFA into the neck to cause neck muscle inflammation. Then we caused prolonged jaw opening. With this caliper that we put in here, we put this little device in. We can open the jaw. We allow that to stay like that for 20 minutes at near maximum. And then what we did is we can measure nociception, so we can measure pain thresholds. And then we also then looked at using ABR, which is auditory brainstem response, and we could measure changes in the hearing response. And what we found is that basically when we did this, we had an increase in nociception in this model. The other thing that we did is we added GSE, or grapeseed extract, which we'd shown to block trigeminal nociception before, and that's what we saw in this model. And then what we decided to do is look at auditory changes. And what we found is that there, in the animals that had the TMD-like pathology, is that we saw a changing in hearing thresholds. And this, it was actually a mild hearing loss, is what we would say, is that basically it took a greater stimulation to get the ABRs to show. And so the thresholds were changed. And then the GSE seemed to be able to block that from happening. And then over here, we looked at the waveforms that are shown here, and we saw changes basically in latency, which means that there's faster conduction in this model. So when animals are experiencing TMD pathology, there's faster conduction, which is kind of indicative of changes in increased sensitivity to sounds at different frequencies. And then we also saw changes in amplitude. And again, this is basically pointing to the idea that there's increased sensitivity. And this is probably a central mediated type of response that's happening. And this is causing, again, basically an enhanced sensitization within the hearing system that is associated with the TMD pathology. And so we're very excited about this. We are continuing studies to try to understand more about how the hearing changes are occurring at the cellular and molecular level, and then also trying to come up with other therapeutic strategies for actually treating both the pain and the hearing changes. Thank you very much.